Hello, my name is Justin Gilligan, and this is the Stroke Recovery and Wellness webinar. So if you're interested in learning more about stroke recovery and wellness, then you're in the right place. So first, this presentation is given on behalf of Therafit Rehab. We are a premier stroke facility, stroke rehab facility. So we've been doing stroke rehab now for since 2006. So it's been some years, but we're experts in it. We're leading innovation. We do a lot of the most modern treatments and whatnot. And we have 5 locations. We have 4 in Maryland and 1 in New Jersey. So we're just excited to give this seminar, especially during this time where a lot of people are stuck at home, and it's just starting to press on everybody, and everybody's looking to just learn more and get out back into the community and back to doing all the things that we love. So first off, who am I and why should you care? So my name is Justin Gilligan. I'm a PTA and I'm one of the owners of Therafit Rehab. Been a stroke recovery expert now for 9 years. I've been helping people with strokes recover for 9 years now, and we've helped almost 2,000 people get back to doing the things that they love. And what makes us different than any other physical, occupational, or speech therapy facility is that we specialize in neurological conditions. We specialize in working with people that have suffered from strokes. Whereas other people specialize on like backs, hips, knees. Maybe they do like a lot with rehab, like joint rehab or back pain, knee pain. But we specialize in treating people that have neurological conditions like strokes, cerebral vascular accidents. So we also, so how did I get into this? So in 2012, my uncle was involved in a really bad car accident, and here he is. This was actually this was Christmas, right before his accident, and he had a 3-month-old son, and here he is with my grandmother, and it was actually the first day he opened up a new business, and he was doing wood restoration, and he was coming back from DC. So he was traveling up to Baltimore, and a car crossed the median and hit him head on. And he was very, very, very badly hurt, as you could see. Here he is. This was like a week after his accident. We weren't even sure that he was going to live through it. And this was kind of like the last time that we were expecting him to really be with his son. And it was just a horrible experience. And through this year of recovery, he was inpatient for a year. Then he went outpatient, and he went to a nursing home of all places. This is a 30-year-old. He went to a nursing home for his recovery, and then they sent him home. And it was like, home? Really? Like, this is crazy. Like, how is my aunt going to take care of him? How is my aunt going to take care of a newborn and him? Like, I mean, I just remember thinking as like a 15-year-old, like this should never happen. How is this even happening? And I remember feeling like the system just failed him. And it's because it did. Like, insurance is so regulated by what they can do. It's not for the benefit of the patient. It's for the benefit of the insurance company. And that's like the cold hard truth. I mean, that's the reality of it. And it just stinks. Like, there weren't even outpatient rehabs or inpatient rehabs even that would accept him because of how bad of a place he was after this accident. Like, we couldn't get him into some of the premier facilities because like he wasn't going to show enough improvement. And like, I mean, a lot of them are geared towards showing improvement. They have to show that improvement to be able to keep their contracts and stuff. So it's like they can only take you if you have so much ability to start with. And we weren't going to accept that. So in 2006, we opened up Therafit Rehab, and we started doing it was actually Therafit Gym back then. And we started working with people with disabilities, just doing fitness therapy, like personal trainers. And in 2009, I graduated from college, and we credentialed to do PT, OT, and speech. And That's now what we do, and we specialize in neurological conditions. So just far different from anything else out there. I don't know if you've ever been to a facility that really specializes in stroke rehab, but we're far different from any of the other companies out there, just because this is what we do day in and day out. So here's Rich now. We're featured in the Carroll County Times a couple months ago, and here he is now. Yeah, he's 13 years after his accident is when he took his first steps. So just imagine that. Like, for 13 years, we worked and worked and worked to get him to the point where he could walk on his own. And it took literally 13 years before he took his first step on his own. So it's just a really amazing process that can happen. And it just shows that determination and dedication is what it takes. So this webinar is for you. If you're worried about your spouse's balance and/or independence, maybe you're a caregiver on here and you're just trying to learn a little bit more so that you could help your spouse or your caregiver, or yourself rather. Maybe you're having trouble transferring, or you're having trouble like doing everything you can, or you feel like you're not doing enough. You're in the right place. We're going to be talking about that. So maybe you're scared of falling, breaking a hip, or being in a nursing home, which is literally some of the worst places that you could be right now. So I would totally understand that. And that is a very good reason to be on this webinar. If you are embarrassed about how you walk, or about your arm, maybe how your arm hangs, if you're just embarrassed by that, you have trouble transferring or getting up from a chair, maybe you're afraid of getting worse or just never getting better, maybe you're tired of using the wall or furniture or a cane for walking, you feel hopeless, like the system has failed you, or you're getting dressed is like nearly impossible and it takes hours. You have a foggy head. So that's something that we hear very often in stroke recovery patients. They feel like they have a foggy head. So this webinar is for you if that is one of you. So I want you to know that you're not alone. Every year, more than 795,000 people in the U.S. have a stroke. And strokes account for about 140,000 deaths per year. That's 1 in every 20 people that pass away are due to a stroke. I mean, it's astronomical amounts of people that die every year because of a stroke. So, and about 1 of 4 stroke survivors will then suffer another stroke. Now, there is one key difference that has been scientifically proven to make an impact that we'll talk about in a little bit. Stroke is a leading cause of serious long-term disability. So if you've survived from a stroke, you're here for a reason, man. And it's game time. It's time to like turn it on and ramp it up, because if you look at the numbers here, if you've suffered a stroke and you've survived, the numbers show, it's incredible. It is amazing. You're here for a reason. So another thing that I really want to talk today about is falls, because a lot of the times, by the time we see the patient, by the time the doctor actually refers them to us, it's after falls. I mean, 9 times out of 10, we get maybe someone that suffered a stroke, they've fallen, and now the doctor says, yeah, you need to go to therapy. My goal is to educate you guys before the falls happen. If there's something that you could be doing to improve your balance right now, to improve your motor control, your ability to move, that could keep you from a fall, that is what I want to do. That is what this webinar is about, and that's what we hope to do. So 1 out of 5 falls result in serious injury, and 1 out of 3 people over the age of 65 will fall each year, and 1 out of 5 of those result in serious injury. These are not even related to stroke recovery. These are just false statistics. So if you have a comorbidity, maybe you have diabetes, a stroke, maybe you have some sensation deficits on the bottom of your feet, these all increase your risk of fall. So it's not common that our patients aren't falling 2-3 times a year. And look, statistics show, I've seen several people have that third bullet point. Several people I've seen this to be true. 1 out of every 5 people with hip fractures will die within a year. That is a staggering number. And my goal is to keep you out of a hospital. That is my goal, to keep you out of a hospital. We need to work on the falls. We need to educate you on the fall prevention. We need to educate you on the things that you can do to better your balance. So that's what this webinar is about. So the first thing we're going to be talking about when it comes to stroke recovery is first really talking about spasticity, because I feel like there's so many people that don't really understand what that is. And this is the tightness that you get, the tightness that you feel down your hips and your arms and your legs. This is that tightness. It's called spasticity, and it is the thing that restricts controlled movement the most. So typically after a stroke, you have one of two things. You're either going to be spastic, where you're really tight like this, or you're going to be flaccid, where the arm just hangs completely down and there's no movement in it. So we're going to be talking about spasticity today. And the reason we're talking about spasticity is because I believe that through controlled movement and through repetition and neuroplastic changes that can happen in the brain, we can start to overcome that tone no matter how long after the stroke has happened. There's science to back this up, and it's what we see in the clinic every day. It's really controlled, repetitious, task-specific movement. So spasticity is the abnormal muscle tightness due to prolonged muscle contraction. So this person has suffered a stroke on the left side of their brain, and it's impacted the right side of their body. So we know that because I can tell that this right side is the side that is affected because it's in a spastic pattern. So spasticity has patterns. This is a spastic pattern. So you see his arm, first off, his shoulder is kind of elevated here. It's not necessarily relaxed. It's a little bit elevated. So that'll happen. You get spasticity in the traps. Then you see this arm is bent right here. So the elbow is bent. So you get spasticity in the biceps. And then you see the hand is kind of like into a fist. And if anything, you'll get this kind of curling of the fist. That would be the other spastic pattern. So it's flexed, it's curled, and it's inward. So that's the upper extremity. And then through the hip, you can see the hip will go into extension. So you see this hip might be flexed just a little bit. You can tell it's bent just a tad. But this hip is real straight. If anything, he's leaning back, right? You see this thigh is really tight and straight. And then you see this calf, the back of his calf is really tight, and it's pushing that leg down. It's pushing his leg down like this. And actually, it kind of curls up and under. So you can kind of see it curling up right here. So it pushes it down into the ground and curls over. And you can see, if anything, he's going to be standing primarily on like these three toes right here. He's just really, so he's pressing down. These toes are pushing that hip up, and it's pushing his arm up, and it's pushing him over onto this left side. So this is kind of what that spasticity does. It pushes him over. So this is abnormal. This is not volitional, meaning this person isn't trying to make this happen. It's just what happens after our brain develops something like a stroke. The neural connections are not transmitting properly, and it's just firing an on signal. It's not telling it to relax. It's just saying everything tight, on, go. So that's what's happening here. The reason we need to know about spasticity is because that the more we know about something, the more we can try to overcome it or work through it. So, all right, next, we're going to be talking about probably one of the most important things that I believe has to be addressed in stroke recovery, and it is attitude. Attitude is everything. This would not be one of the first recovery slides that I put up if I did not think that it was highly important. So studies show that a positive attitude of both the therapist and the patient, mind you, it's not just one. Like, there's studies that go both ways, showing therapists that don't have a positive attitude and showing patients that don't have a positive attitude. So if the therapist thinks the patient can't do it, guess what? The patient ain't going to do it. If the patient thinks they can't do it, guess what? The patient isn't going to do it. So one study even correlated negative attitude with a 22% death rate in people within 3 years of their stroke. So that meaning like people that thought like fatalism or fatally, they felt helplessness, they felt hopelessness, had 22% higher of a chance of dying within 3 years of their stroke due to another stroke or some kind of condition that was correlated with that first stroke versus a fighting spirit. And I'm talking a fighting spirit. The people that I see do the best are people who do not give up, who do not believe that they will succumb to anything other than the best that they have for themselves. Like by far the number one thing. And there is another part there. I bring this up because this is a huge thing. The reticular activating center in your brain. It's a reticular activating system. It's a portion of your brain it's a very deep portion. It's like it's in the midbrain. It's a very, very, very deep portion. And typically, strokes are not affected by this part of the brain, right? But it's basically our subconscious. And what we speak to our subconscious, it starts to believe. So this is a picture of my son riding a balance bike. And he's 2 years old. And the first time that he fell after riding his balance bike, he got up at 2 years old, looked at me and said, "I can't do this." And I said, "You can't do it yet, bud. You can't do it yet, but you're learning and you're getting better every time." Now, the reason that I say that to him is because the reticular activating system in your brain, when you give it a problem, it starts to find a solution. So like if you don't have enough money to pay for something, your brain starts thinking of a way to get more money to pay for something. Versus if you say, "I don't have enough money," then your brain says, "You don't have enough money." So if you say, "I can't ride a bike," guess what? You can't ride a bike. Your brain will actually start to tell you that you can't ride a bike. But if you say, "I can't ride it yet," then your brain starts to think of ways to help you ride a bike. And this is true. I know most people have experienced this in a way that, like, if you ever went to bed with a problem and then kind of woke up with a solution to it, you went to bed telling your brain to focus on something, focus on a solution for my problem. And not consciously, but just in your subconscious, you're just telling yourself that. And then guess what? Your brain starts to work on that solution. And before long, you're like, "Oh crap, this is like the easiest thing that I could have thought of," you know? And you don't think of it because you're maybe not like, start telling your brain that. Like, get that fighting spirit, start telling your brain, like, "I can't do this yet. I can't walk yet. I can't stand yet. I can't balance yet. I can't run yet. I can't ride a bike yet." And then start letting your brain figure out how to help you through it. And it will. That's the reason that it's the number one thing is this is where it starts. You start with that fighting spirit and then put somebody in front of me with a fighting spirit and we will be able to rock and roll. So the next thing is stretching. And I'm not talking stretching just to stretch or some kind of yoga-y stretches. I'm talking very task-specific stretches. So stretching does not cure spasticity, but we need the right proper range of motion to perform the task-specific goals that we have. So again, not stretching to stretch. I don't want you just cranking on your hamstrings trying to stretch them out. But I'm talking like if your goal is to open up a jar and you don't have the ability to open your hands past here, like not just because of spasticity, but I start pulling on your hand and I can't get it all the way open, then maybe we need to stretch those extensors on the back of your hand so that we really are able to get them further open, because right now they're just so tight. So that's going to be kind of what I'm talking about here is, and I said extensors, I meant flexors. We're talking flexors in your hand. They're so tight, we need to pull them into extension and stretch them. So, but that's kind of what I'm talking about here is task-specific stretches. 9 times out of 10, if you have suffered from a stroke and you have spasticity, then you probably have really tight hip flexors. So that's generally, those hips are just constantly tight. Those thigh muscles are constantly tight and tight and tight. So it's like stretching them to get that range of motion back. Those are the types of things we're talking about. Not just stretching to stretch, but really task-specific stretches to be able to do the things that we need to do. So that's kind of where we start. We start with attitude, and then we look at what needs stretched so that we can perform the movement goal that we have next. So, and there's this concept called learn non-use, but if have you ever heard of like, if you don't use it, you lose it? It's like 100% true. If all of a sudden I just stopped moving, guess what? In like a year, I wouldn't be able to move 90% of my joints. It's like they just get seized up, the muscles get tight, everything would atrophy. So if you don't move it, you lose it. That's 100% true. We need to be moving, stretching, moving, doing those functional movements, focusing on task-specific things. Again, you're going to hear that this whole entire webinar. But so this was actually a study that was done, and the study was use it and improve it or lose it. So you've heard use it or lose it, but this is use it and improve it. So it shows, this study actually showed that some like task-specific repetitive movements can improve over time. And they kind of debunk that, that whole myth of once you lose it, you'll never get it back. It's like use it and improve it, or lose it and use it, right? Use it or lose it. All right, so next we're going to be talking about motor learning and neuroplasticity. So neuroplasticity is the brain's ability to reorganize itself by forming new neural connections throughout life. So like your brain's constantly going through plasticity, like it's constantly reorganizing itself. So like you learn something that's really important, your brain puts that force center and it pushes information that's not important back further, right? So like our short-term memory, we're remembering all those things, but our longer-term memory, we don't remember every aspect of life. Your brain's constantly like reorganizing itself to keep the most important stuff kind of accessible to you. This happens all throughout life. So kids go through a lot of neuroplastic changes because they're learning so much, right? They're learning how to ride bikes. They're learning how to walk, how to speak, they're going through school. They're constantly learning stuff. So they're really plastic brains. Whereas like as we get older, we tend to learn less. We tend to do less. We're a little bit more sedentary than a kid. And we don't challenge our brains as much. Other than they just kind of like, again, use it or lose it. They start to not respond as much. So this is kind of the 3 stages to cognitive learning or to motor learning. So we're going to go through each one. The first one is cognitive stage. So this is the stage where like it requires a ton of thinking, like practice, and just tons of thinking. Like, so my daughters, we're really into bikes right now. Everybody's riding bikes in our family. I have 4 kids, so we're always riding bikes at this point. But here's my daughter. She's 4 years old. She just learned how to ride a bike. It was really, really awesome. She's been our youngest to learn how to ride a pedal bike at 4. But you think about like trying to ride a pedal bike at first. You're having to balance the bike. You're having to pedal the pedals and steer and not hit obstacles. You're having to like think and process multiple things at once. It's very tough. Your brain is constantly thinking at that point. Then we go to kind of this associative stage. So it's less thinking and you're starting to really develop control, but it takes a little bit of effort. Still, like less effort than the first, but still a bit of effort. So that's kind of where she is now, right? So she just went through the cognitive stage. She's kind of learning, but guess what? If she takes her mind off too long of riding a bike, she'll just fall. She doesn't know how to brake well yet. She'll run into a pole. Her steering's still a little bit iffy. She's not quite to the preferred stage, which is that autonomous stage. And now you're like consistent and accurate movement. Like you can just hop on that bike and you can go anywhere, right? Another way to think about this is like if I jump in the car on a Saturday by myself and I start heading down 140, sometimes I'll find myself at work because driving to me has become such an autonomous thing. And like I'm so used to going to work Monday, Tuesday, Wednesday, Thursday, Friday that like if Saturday I jump in the car and start along that path, guess what? I'm gonna wind up right back at work because it's just automatic to me, right? It's that automatic stage. That's what we're going for, right? Walking the door, if someone knocks at the door, I'm just gonna jump up and go grab it. I'm at that autonomic stage. I'm not having to focus on it a whole lot, but it's consistent and it's accurate movement, which is really what I want you guys to pull away from this. So now we're going to be talking about motor retraining, which is, and repetition, repetition, repetition. That's the first bullet point because guess what? It takes repetition. It is not something that happens overnight. All right. It is not something that happens overnight. A stroke might happen overnight. You might lose that ability overnight, but you will not get it back overnight. Motor retraining takes time and it takes practice. If you're not, that's that fighting spirit, right? If you're not willing to practice and take the time and put the energy into it, you're not going to be able to get as much out of it. You're just not. So this is specificity, right? Specific to a task. So if we're taking movement retraining, we're specifically focusing on a task. That's the easiest way to do this. We're not specifically thinking about just even a movement, but we're focusing on a task, like opening up a jar or standing or walking or pre-gait, like pre-walking activities, right? So we're focusing on one specific task, and then we work from there. So in this stage, you really need to be able to overcome some of that spasticity that we talked about before. And the way that we do that is through controlled, efficient, goal-oriented movement. And I really want to get this out. This is not strengthening. It is not strengthening. We don't want to make the quads stronger. We don't want to make the muscle stronger. It's not the strength that is wrong. It's the control. It's the movement. It's efficient, effective movement. We're looking for specific movement. We're not looking for strength. We're not going to the gym. We're not busting out 100 reps of something to get stronger. That is not what this is. This is movement retraining. It's goal specific. It's task specific. And it's not strengthening. It is good functional movement. Goal-oriented, efficient, functional movement. I'm going to really focus on that. Do not focus on the muscle. Instead, focus on that movement. So what I've done here is I've broken something down into like 3 different categories, right? So the goal is to try to stand and move the foot back and forth, okay? But we're not going to be able to start there. We need to start in trying to overcome that spasticity because we know when we stand up, right, we're going to go right back to this. When we stand up, that hip's going to extend. It's going to be really hard to bend. It's going to be hard to pick this knee up because this hip is extended. And that tone follows this synergy pattern, right? When this hip is extended, everything wants to fire. Everything wants to turn on. So we got to focus on one single movement. Not every movement at once, but let's focus on this hip, right? This hip bends and it extends. It flexes and it extends, right? I'll try to show you guys real quick. I can bend my hips and I can extend my hips. All right. So we want to focus on that movement, but when we extend our hip, this is what happens, right? When you stand up, everything gets tight and goes into extension. So when we're looking at trying to retrain that, we want to take out the tone and we want to focus on just that extension in the hip. So this is what we're going to do, right? We'll get you lying on a mat and we're going to bend your knees because that's going to help to take the tone out. And now if those knees are straight, what's going to happen? Everything will turn on because the knees are straight and the hips straight, and then you're going to go right back into that spastic pattern, right? But if we bend the knees, it helps to break up the tone. And then we can work on that specific task of bending the hip or straightening the hip, bending and straightening the hip rather. So we're lying down on a mat. We have the knees bent the hips bent. See that? They're not straight yet. But if we pick the buttocks up off the mat, then the hips become straight. Now, if we pick the buttocks off of the mat and this foot wants to straighten out too, then we need to isolate it even more. So we're taking this main goal of standing and moving, and we're breaking it down, because what do we need to do to be able to move that leg back and forth? Well, first off, we need to be able to move our hip, right? Because when you're kicking that hip forward, that hip's moving, right? So it goes out and it goes in, it goes out and it goes in. That's exactly what we're doing. We're just doing what we call closed chain activity with it, and we're doing it laying down. So the hip's bending, and then it's coming up straight. Task-oriented, goal-specific. We have a goal that we want to stand and move then the hip back and forth, but it's task-specific because we're just breaking it down, right? We need to control this tone first. So we're going to be doing this a whole lot. We're going to be making sure that we can control it, that it's controlled, that it's strong after that we have a good, strong, controlled activation of the hip. And then we're going to move to maybe the next thing, which would be, well, if we want to move this ball forward and back, we're going to need the hamstrings and the quads to be able to work. And we're going to need to be able to fire one and then turn one off. Fire one and then turn the other off. In order to do that, we know that this quad muscle, if we're standing up, again, it's going to want to be firing. That knee's going to want to be straight. It does not want to bend when we're standing up. So we're going to sit down. Now, in this one, we took out the knees to prevent the tone from coming in. In this one, we're going to bend the hips to prevent the tone to come in or to elicit a response. Now we can work on this movement of back and forth, moving the knee forward and back, right? Because at the end, that's what we want. We want to be able to move this hip forward and back, and we want to be able to move this knee forward and back without making that hip tense up. This is the last one, and this is like where we're in standing, putting everything together, right? We have the bent hip and the bent knee, and we're working on both of those movements. And then eventually we translate it into walking, right? So that would be the main goal, which would be being able to walk with a bent knee and a bent hip. But it doesn't get there without doing these three first. So again, movement retraining. Very, very, very task specific. We're breaking it down. We're focusing on one thing. We need to ace this before we can hit this. We need to ace this before we can hit this. We need to ace this before we can walk. And then stairs are another thing, and unlevel surfaces. It just gets harder and harder after a straight level surface, right? So it's really about taking all this, breaking it down, and focusing on task-specific and task-oriented things. So again, motor retraining, this is how it's done. There's no magic pill. There's no magic formula. It takes work. It takes dedication. It takes a fighting spirit. It takes a lot of time, energy, and effort. And it's not just 2 hours a week at therapy. That is not enough time to do this. This takes time. It takes energy. It takes effort. All right, the next thing we're going to talk about is balance, because, hey, after we get up into standing, we need to be able to balance ourselves. And this is really where I always go back to the basics, right? Start at the fundamentals. So what is balance? Balance is your ability to maintain your center of gravity over or within your base of support. So I'm going to explain this, and hopefully my little guy will help. So this guy, this is his center of gravity. So your center of gravity is the center of your mass, where your body is forced to act in order to maintain itself. So this is the center of the mass right now, and you can see this is its center of gravity. It always sits at your hips when you're just standing up with both feet shoulder width apart. Standing up, it sits right at your hips, so right at your belt line. So you can see when he moves forward like this and touches his toes, the center of gravity moves forward. You can see when he leans back, the center of gravity moves from here to back. And you can see when he leans to one side or the other, it moves over. Now, his ability to maintain his balance solely relies on So this is the transverse view, right? We're looking down on him right now. So here's the center of gravity. Here it is within his base of support. So this is his base of support, right? 2 feet on the ground. Your ability to balance yourself means this center of gravity has to be inside of your base of support. The moment that this ball travels outside of your base of support, right? So here you see it's outside of the base of support, but his hands are on the ground, right? He's got to catch himself because right now he's falling, right? Unless he puts his hands out. You see right here, when you're leaning back, you can see right here, there's the base of support. It's all the way back. That means all of his weight is where? All of that weight is right on the heels. If he leans any further back, that ball is going to travel outside of the base of support, and he will either fall or have to catch himself, do something. Something's got to happen because now he's tipped the scale and he's lost his balance. Same right here. So you can see that picture going back to that guy that drawing, this guy that had the spasticity. He was all on one side, right? He was pushing off this side all onto this side. So you can see all of his weight is right here, which means his balance is now shifted. His center of gravity is shifted. He's not able to maintain a good base of support and a good center of gravity. He's now pushing his center of gravity to his other foot. So we're going to talk about the strategies. So after you lose your balance, something has to happen. And there's really 4 things that can happen. You either fall, or your ankles will kick in and try to catch you. So what happens there? You're falling forward, while your toes are going to fire, and they're going to try to push you back to your heels. So you're falling forward, all that weight's coming forward onto your toes. Your toes are going to try to push down into the ground and push you back onto your heels. So it starts from the ankles. The ankles kick in and they try to keep you balanced. Next comes the hip strategy. So if you start falling and your ankles can't catch you, then you're going to throw your butt out and bend your knees to try to catch you. And that's going to be the hip strategy. So the first thing you do is try to fix it with the ankles. If you're still falling, you're going to kick your hips out to try to get yourself forward, right? So this person's falling back. They're trying to kick their hips out to get their head forward to counterweight themselves. So you see now their base of support's like right here, back over top of their feet. And then the 4th thing that you can do is step. So that's what most people think of when they feel like they're losing their balance. What do? You kick your foot out and you step. So you're leaning forward, you feel like you're going to fall, and right before you fall, you step out and you catch yourself. So that's that 4th one. Now, these are the things that we work on as therapists with balance. If we have a balance issue, we're typically saying, which one of these do we need to work on? Maybe you have a really good hip strategy, but you have no ankle strategy because of all that tone, right? That tone goes through that ankle and it rivets it, and you have no ankle strategy. So now we have to compensate, or we have to work through it and learn how to better that ankle strategy. Maybe it's stepping. Maybe you have very poor reaction time and you can't catch yourself, so you find yourself falling a lot. So maybe we need to work on that reaction time, quickly moving that foot to catch yourself. Some things that impact balance are going to be your sensory system. So maybe you have something like diabetes, or you've suffered from a stroke that inhibits or it affects your ability to feel the bottom of your foot. That's going to affect your balance. You're going to have a hard time understanding where you are on that foot if you can't feel it, right? So another thing might be your vestibular system. So sometimes a stroke can impact your brain's ability to know where you are in space. So like you might not know that you're even falling. You might have no idea. So we might need to train that portion in to where like now you're like, okay, I understand that if I'm here, I need to do something. I'm technically falling, or just better your idea of where you are in space, right? So the next one might be a visual deficit. So if you close your eyes and you have a harder time balancing, then that tells you that your eyes are giving you a whole lot of feedback. You rely a lot on your eyes. Your brain relies a lot on your eyes, rather, to understand where you are in space. So like your eyes tell you, oh yeah, I'm falling backwards, or I'm falling forwards, or I'm on one side as opposed to the other. Your eyes might be doing a lot of that information. So then we might have to work a lot on your eyes and your body so that your body knows that you're falling, you know? And then your muscles, your musculoskeletal system, your muscles. So just your weakness can like there's times that yeah, we just need to strengthen something. Like maybe the quads really aren't strong enough to help you stand. So we really need to work on building that quad strength. Other factors are medications. So some of your ACE inhibitors, beta blockers, which a lot of stroke patients might be on, vasodilators, antiarrhythmics, opioids, pain medicine, affects balance. So a lot of those things could be affecting your balance as well. I don't recommend getting off of them, but it's just something that we need to overcome, right? And then also your home environment. And we already kind of talked about attitude, but that goes along right with anxiety and depression. If you're afraid that you're going to fall, guess what? You're telling your brain's figuring like it's not working on how to solve the problem of falling. If you're telling yourself you're scared of falling all the time, then your brain, your subconscious, again, that particular activating system, it's telling you you're going to fall, you're going to fall, you're going to fall, you're going to fall. And guess what? When your brain's telling you that, you're telling you that, then it's probably going to happen. So you got to get on the other end of that where you're thinking like, how can I improve my balance? What can I do to improve my balance? And again, I don't let my kids talk like that. I don't let my patients talk like that either. Like you better be talking to yourself in a manner that's going to help us get through this together, right? All right. I wanted to talk a little bit about wellness because it's incredibly important, but I'm by no means like an expert in it. I know just enough to get dangerous, but we really have some people that we work with to recommend certain things. But this is what I know. I know that food that we consume on a daily basis has the ability to affect every single cell within our body. So that means it affects your mood, it can actually affect your brain's pH, your brain's ability to reheal. The food you eat can actually affect that. The ability to focus, it can affect your energy. Like if you're feeling like just like you already have that brain fog, right? Like come on, like just eating the right foods could really give you a boost of energy. It helps your memory, your sleep, your immune system, allergies, stress response, weight, digestive health, and everything in between. Like food really impacts your body, and getting the proper food is highly important. So here's just a list of some of the things that you can get in terms of food that could really impact your, they're like restorative foods, right? The foods that would really help your brain. And it's going to be like your really dense fatty fish, like your fat omega-3 fats. These are going to be like your fish, your salmon, your herring, avocados. Again, got that really healthy fat. Beets, berries, avocado, coconut oil, green tea, fermented foods, eggs, dark chocolate, bone broth, all these things. It doesn't necessarily mean that you have to eat horribly or you can't enjoy food. It just means that you really need to watch out what you're eating so that it can contribute towards positive brain health, positive body health, positive gut health. And a lot of times, like sometimes just changing your diet, you can get off of a lot of meds, cholesterol meds. Like there's like the right diet can really help your body out and can really put you in a place that I've seen even people come off of some really important meds before just due to the really paying strict attention to their diet. And some of those supportive vitamins that I threw in there are just multivitamins, magnesium, vitamin A, iron, vitamin D. If you're not getting some of these, a lot of them work off of one another. It's like, omega-3 just doesn't filter into your body fantastic unless you're incorporating some of that vitamin D and iron, calcium. It's those types of things. They all work together to be absorbed into your bloodstream. So we have access to a company that we kind of partnered with called BrainSpan, and it's actually a neurologist that has made it's like this interactive food guide, but basically it's a blood sample and it's also a cognitive test, and it will basically tell you your brain's pH, and it'll help you figure out the foods that you can eat to enhance your brain's function. And it's like $70. It's worth its weight in gold if you're going to follow it, because like I said, I've seen it impact people in a way that's just, it's really blows my mind. All right, so when should you seek professional help? By far, the golden goose egg here is if you've fallen in the last year, you should be in therapy. I am a strong advocate of that. If you have fallen, you should be in therapy. It is again, falls are the number one reason for nursing home placements. They're number one reason for broken bones. They're the number one reason for hip fractures, So if you've fallen in the last year, I am urging you, go see somebody. It is not worth waiting. It is not worth waiting until after a fall to go to rehab, to get physical occupational therapy, speech therapy. It's not worth it after a fall. That is the wrong time to do it. If you've fallen in the last year, if you've fallen 2-3 times in the last year, you really need to be on top of this, because it is very easy to break a bone, especially in our ladies and gentlemen that have suffered from a stroke. Typically they have osteoporosis, weaker bone density, and they break their bones easier. So really, I'm spending a lot of time on this because I believe it's highly important. If you have a goal for yourself that you want to get back to doing, I love that. Task specific, again, goal oriented. If there's something that you want to do, if you don't care to dress yourself, but hey, like you really want to get back to bowling, that is a really great goal. We can break it down. We can focus on that task specific movement of bowling. But again, cooking, dressing, hobbies, transferring, walking, whatever it is. But task specific goals, if you have something that you're really looking to get to do, maybe it's turning on the lights or opening up a door, maybe it's driving, whatever that goal is. If you have a very task specific goal, those are the kinds of things that, seek a professional for help. Come to us, come to somebody. If you're willing to work really hard to reach your goals, if you have that goal, but again, you're like on the other side of the fence with that helplessness, hopelessness, it's going to be very difficult to achieve. If you have that fighting spirit, if you believe in yourself, if you have a therapist that believes in yourself, woo, that's a deadly combination right there. If you're caring for someone that's had a stroke and or want to learn about how you can help them more, that is a really good reason. Even if like maybe the person that has suffered the stroke doesn't necessarily want to come to therapy, but you want to come to therapy so that you can work on your transfers or getting into and out of bed, hygiene, whatever it is with that patient, that is a reason enough. We can justify that you should be in therapy. I've seen some very bad transfers in my days, and it is just a matter of time before people will have very bad back issues because of how they're transferring. So, and then if you want to be more independent, it's a great reason. Come on and get some help. So what can physical therapists do for you? We can help improve balance, again, by working on those ankle, hip, and stepping strategies. We can improve the length of a muscle, like just stretching, right? Improve that range of motion so that we can do that task-specific thing. We can help regain muscle control and function. We work on reaction time and power in the lower extremities, right? Quickly getting that movement so that we can catch ourselves if we're falling. Improve the ability to stand from a chair, sit to stands. Like that's a huge thing. You need to be able to sit and stand from a chair. Improve body awareness. Again, just knowing where you are in space is a huge precursor to being able to walk and do functional things in standing. Practice getting up from the floor after fall preparedness, right? Being able to assess yourself after you've fallen, then make sure you can get up from the floor. Help caregivers with transfers, kind of hit that, and then improve walking or ambulation, just improve your ability to walk. We've helped people walk out of canes before. So it's amazing, right? They had a cane coming into us, and we were able to get them to the point where they didn't need the cane anymore. So really amazing stuff. What can occupational therapists do? They help with everyday living skills, right? Compensatory strategies. So first we're going to focus on let's just get you as independent as possible. Dressing yourself, bathing yourself, brushing your teeth, doing your hair, getting your clothes on, cooking for yourself. First, we focus on those things. Let's get independent by using compensatory strategies. Then let's focus on regaining those movements, right? So it's like get you independent, then let's focus on really regaining that movement to be able to do it. So it's like, let's figure out how to open up a jar with one hand. Now let's focus on how to open a jar with two hands. That's the difference right there, right? Energy conservation, if you're just exhausted all the time, there's strategies that we can implement to help fix that. Using adaptive equipment for dressing, bathing, and cooking. They have all these fancy little gadgets and gadgets that they use to get socks on, shirts buttoned, all kinds of stuff. So modifications for daily life. Again, they're always thinking so creatively. I'm not an occupational therapist. I always really, that right brain creativity that they have is just really inventive and creative, and yeah, it's really amazing. Range of motion in the arms, again, we kind of hit that. Low vision impairments, they're the ones that fix that vision stuff, right? If you have impairments in vision, depth, can't really figure out like where, how far out something is in front of you. They do a lot of that stuff. Home safety evaluations, they actually come to your house and will help you modify your house in a way to make it as independent as possible for you. And then they do home exercise programs. So what can you do next to improve yourself? If you have the fighting spirit, if you have goals that you want to be able to crush and get back to doing, and you're liking everything that we talked about, we are open during COVID. We're offering telehealth visits. We're offering home visits. We'll actually come to your house and see you in your house. We're taking all the precautions possible with doing home visits and clinic visits. We have KN95 masks. We're coming with gloves. We're wiping stuff down. We're requiring everybody to wear masks so that we can keep each other safe. We're doing, we actually have like decreased our treatment times just a little bit so that we can wipe everything down in between patients. We have their front desk are contributed. I mean, just like we're taking the utmost precautions. You even having to get your temperature taken before entering. Our visits are one-on-one in clinic. So it's like you're literally just coming into contact with one person throughout your time. We're asking people to come in one door and out another door. We're asking you when necessary or when available to schedule your appointments out like during our appointment session, not after the appointment session, or at home, like just calling in. So we're really taking a lot of precautions to make sure we're keeping everybody safe. But if you are falling right now, you like a fall at this point in time would be much worse than like being in a hospital right now with after a fall would be much worse than being in our clinic or even having us come into your clinic or your home or doing a telehealth. Like telehealth, it's just like this, right? We're able to help you out just from the other side of the computer screen. Like we can make a plan of care. We can work with you right from the other side of this screen. So if you're not comfortable coming in, there are options. You can do things without having to jeopardize your health and well-being. So if you're falling, if you have a very specific goal that you want to get back to doing, please utilize one of these. The last one is our free streak screen week. So it's this week. We're having free screens for stroke recovery, and it's a 15-minute consult with a therapist where we block amount of time. They are limited. We only have so much availability on our schedule for these screens. But if you're interested, I urge you sign up right now. If this link that I'm giving you here is showing up, then it's still available. There's still spots left. So all you need to do is go to this link here, and it should be on this. It should be to the right of the video right now if you're watching this online. And I'm sorry it's taken a little bit of time. My internet goes slow when I'm doing these videos. But it should be this right here. You just need to put in your phone number or your name, your last name, your phone number, your email. Make sure you select the location that you want to do your visit at, and then how you want to set your visit up to confirm it. But it's just this little thing form right here. I urge you, if you are falling, if you've fallen, if you feel like you're going to fall, if you're unsteady on your feet, don't wait until after the doctor sends you. All you need to do is fill this form out. It'll get you going. It'll get you seen by us, and we can assess you, and we can say, yeah, like it's literally a couple of quick tests to say, like, yeah, you definitely need therapy, or I think you're good right now. You don't need to risk coming into here. We can just do it over telehealth, or we can wait a couple of months until you need another checkup. But it's worth it to get into the clinic and at least get that visit so that you can make sure that you're, we have norms, like relative norms to the rest of the world that we can compare and say, based on like people that fall and where they were at and where you're like not likely to fall, or yeah, you are likely to fall, or yeah, you're in the middle. We can pretty much give you some really accurate data in terms of how likely you are to fall. So all you need to do is fill out this form to be able to get that consult. And again, the link should be posted on this page that you're watching this webinar from. So it's just that link right there. So if you have any questions, please feel free to email me. The main thing that I want you to get from this is stroke recovery is really boils down to task specific things. It's not strengthening to get stronger. It's not stretching to stretch, but it's what is the task and how can we get that task back? And we talked about all the huge things that incorporate that, all of the neuroplasticity and all the different things that we can work on to improve that. So you just really need to press in. You need that fighting spirit. And if you have that fighting spirit, fill out this form and let's see where it goes, because there's no telling. Recovery is not, there's no end date to recovery, right? You can always improve yourself, just like I can improve myself now. I'm not going to going out and running a marathon right now. I would need to practice and practice and practice and practice and practice before I built up enough stamina, muscle, and endurance to be able to run that race, right? It's the same thing with stroke recovery. You have to be able to be committed to it. You have to be able to practice. You have to be able to lean into it and really do the work that it takes to run that marathon, right? Imagine how much work it would take me right now to run a marathon. I mean, I would be having to run at least 4 or 5 times a week for months before I would get to the point where I could really be able to even think about maybe a half marathon or something, let alone a full one. So you really, really, really need to take this, again, that fighting spirit. If you have the drive, if you have the determination, then run that marathon, run that race, and get those results that you're looking for, All right. I will be accepting questions. Just respond back to my emails if you have anything. It's justin@therafitrehab.com. If you're looking for this, the direct link to this specific page is therafitrehab.com/free-consult-stroke. So try to make it easy for you guys to type in if you want to get that stroke consult. And if you have any questions, like I said, please let me know. Email them, post them to Facebook. Somebody will get back to you. And I'll be looking forward to seeing you guys soon. So stay safe. Thanks. Bye.